good treat today. I'm very excited to be able to have an old friend to be able to sit with me today and have a fresh conversation about some things that's been happening. You've been seeing it, man. You've been seeing some growth and development for Doctors Hospital here in the city of Nassau. They've sat with us a few times. You heard their commercials. They're really being able to be proponents of healthcare and talking about it, not just locally here in the city of Nassau, but throughout the family of islands, and really being able to bring top tier healthcare to these particular persons. And all friends joining me today, taking over the position of interim manager for marketing and also loyalty program manager, being able to do those things. Ladies and gentlemen, none other than Carlyle Bethel. My brother, it is good to see you today.
It's a pleasure to be here. Thank you, Howard.
I like this capacity.
Yeah, man. It's a wonderful to give back through healthcare.
Yeah, but talk to me about it. I mean, I've been seeing Doctors Hospital do a lot. I mean, a lot over the past, I'm going to say year and a half, 2 years, really being pushing for this thing. I see they moved on Mackey Street. They give you delivery. They do all these things. Even in a post-COVID environment, you get access to those things. Talk to me about what's going on over at Doctors Hospital.
So first off, thank you for having me. Thank you to the Guardian Radio, to the entire Nassau Guardian family for the wonderful work you all do in news and coverage on a daily basis. You all work around the clock. So thank you for that. When people think about Doctors Hospital, we think about the hospital on Shirley Street and Collins Avenue. You know, in 2025, we celebrate 70 years of operation. We started in 1955 under Dr. Meyer Rassen. It was a clinic, and we built that into a publicly traded company, a massive hospital on Shirley Street, providing private healthcare. And then from there, we have decided that we are going to do all that we can to make healthcare more accessible, more affordable for everybody in the Bahamas. And provide that same quality of care that people have grown used to.
You know, it's an amazing thing, not to draw comparisons, but if we look at the whole scope of healthcare in the country, even throughout, well, let's say the country, we don't get into the region, but we understand that Doctors Hospital has been providing top tier, right? Top tier.
Yep.
Top tier quality service to those particular persons. And even if you look at the contrast of the services that are offered, whilst they're moving, it seems as though our Doctors Hospital has been moving in leaps and bounds over these years and had a significant commitment to the growth and development of these things and strategically putting it in remote communities that they can be able to access this stuff. Talk to me about that.
Listen, Doctors Hospital is one of 2 hospitals in the region that is JCI accredited. So what is JCI? JCI is an international organization which comes in and they walk through your hospital and they look to make sure that everything is up to standard. You have proper signage, the rooms are up to standard. There's proper management and they do a full assessment. They really peel back and look at the layers. And we are one of 2 hospitals. Health City in Cayman Island is the other one. And we wear that gold badge with pride because we know that the services that we provide at all levels, as you mentioned, from clinic to hospital and everything in between, is of a certain standard, internationally recognized standard. And Doctors Hospital has taken that from that one location on Shirley Street. We've opened up about 13 outpatient clinics. We have a presence on the ground in Exuma with a clinic. We have 2 clinics in Grand Bahama, 8 Mile Rock, and the Carlyle Medical Center and the Freeport Medical Center. We are in the process of opening up a clinic in Eleuthera, Rock Sound. Shout out, my family's from Eleuthera. So I'm very excited about that. And then we are also opening a brand new state-of-the-art hospital, full hospital, emergency care, urgent care, specialist imaging labs in Freeport, Grand Bahama. And that's exciting. It's exciting.
Crazy. How do you make these determinations to do this? Maybe I'm getting too deep into this.
No, man.
Let me tell you why. Because I used to go to Dr. Cavallo. In 8 Mile Rock.
They love him. They love.
How did you come back yesterday? Right? It's Dr. Cavallo, right? How did you come back? He knew me from a child.
Right.
A baby.
Yeah.
He knows my mother. He knows my home, Dr. Cavallo, right? He would always tell us, I haven't seen you for a long time, right? So we always thought that this was superb service that he offered independently because he started off at the clinic, the government clinic. Then he opened up his own individual thing right there in Hannah Hill, 8 Mile Rock, my home, right? And being able to see that when Doctors Hospital made that purchase, kicked off everything, my mother was there. I wasn't there. I was here, right? But this was a part of the community. So when Doctors Hospital came in and did everything, I always thought, I wonder how you made that decision. How did you make that decision? Did you make a decision based upon the denseness of the community? Did you make the decision based upon the movement of the community? Because we've always viewed ourselves as indifferent and apart. But Doctors Hospital was able to kind of bridge that gap and bring that service right to us. Talk to me about that.
So the real vision lies with our president and CEO, Dr. Charles Dacus, who has been a pillar in the medical field in the Bahamas and the region for years, similar to Dr. Carlyle. And in fact, Dr. Carlyle, when he was getting up in age, he was considering retiring
and
and
go
so
back
forth.
to India. Tell me the whole story.
Right. The question was, well, what do I do with my patients here in Grand Bahama?
Yes.
And so he, instead of just packing up shop, he had such a love for the community, as you pointed out.
He really does.
And
he was
everybody,
a part of the community.
And we were just in Grand Bahama yesterday. And the way that people speak about Dr. Carlyle.
We know he's a part of the family.
Precisely. And so he wanted to find a way to keep his practice going. And he entrusted Doctors Hospital with that, to keep that medical healthcare presence in 8 Mile Rock. And so we opened up the Carlyle Medical Center, and we named it in honor of him. And it didn't stop there. We said, let's keep expanding into our family islands. We call it the Eagle Initiative. Exuma, Abaco, Grand Bahama, Long Island, and Eleuthera. And we opened up a facility, urgent care, primary care facility in Freeport. And right next to it, we opened up, like as I mentioned, this brand new hospital. I mean, that hospital is magnificent. It is 3 stories. It is hurricane grade, poured concrete straight through. And it is all a part of a broader and a wider initiative to make healthcare in the Bahamas more accessible and more affordable to the average person.
When I look at this, I like this Eagle Initiative. Would you say Eleuthera, Abaco, Grand Bahama, Long Island, Eleuthera,
and Exuma.
Exuma, right?
Yes, sir.
This is an exciting thing.
Yes.
Let me tell you why. I look at this and I think so much of us have been waiting for a long time for the proverbial savior to come in, right? Entrepreneurs, business persons who have ideas, dreams, hopes, aspirations, and they have something that exists within them, but they don't necessarily have, I don't know, the willpower or the support to be able to make those steps. I'd like to be able to know more about Dr. Maya Rassen and being able to initiate this particular concept, the relationships associated with how this came about in Collins Avenue and now spread out through the entire country, soaring high with a set of a concept of the Eagle Initiative. So I'd like to know about that, and I really want to commend you guys more. I want you to tell me about, I think you guys have like an event coming up.
Precisely. We have the Maya Rassen Foundation Gala on February 22nd at 7 p.m. But before we transition to that, I just wanted to expand on that Eagle Initiative to kind of explain, what really was the thrust, right? When COVID came around, there was a glaring lack of capacity in the country when it comes to healthcare services. And prior to COVID, Doctors Hospital was the place where you went when you wanted to stay alive. You go to the emergency care center.
Come on, that's wild. But go ahead.
You go to the emergency room, and you know that once you're there, you will receive top class care, right?
Yes.
And so, what we did when COVID came around, there was a demand for lab work, for imaging work, for assistance with taking care of our fellow Bahamians, and Doctors Hospital really stepped up, and in doing that, we realized that...
And superb testing during the COVID time, let me tell you why. Because my wife, we do everything with doctors, right?
Right.
So my wife, we went into doctors. She was pregnant with my last baby. And this was COVID time. And we had to take the test. Before we can get into the hospital, we had to take the test. So I took the test. I was clear. She took the test. She had COVID. Pregnant. I said, how does this work? This woman ain't cough all week.
Right.
But that is the sort of intimacy and the accuracy of how you guys do your stuff.
I mean, it really was a team effort. I mean, and we had nurses on the front line, physicians on the front line. You had executives who were running specimens and running supplies from one location to the next, because at the end of the day, it was about getting the job done and stepping up when needed, as Doctors Hospital has always done. And so Doctors Hospital, we are focused on making healthcare accessible and affordable. Now with Maya Rasan, Dr. Maya Rasan, he was a physician, and he had his own personal practice, and he was, as the story goes, I was speaking to his son, Barry Rasan, who was a former CEO of Doctors Hospital, who was really instrumental in turning Doctors Hospital from a one-man shop and a clinic to an actual operating, publicly traded hospital with massive capacity. And he said, he remembers growing up running around the clinic and the hospital when it was first being built, and what led his father to do that, Dr. Maya Rasan, was he was working with a patient at I think it was PMH actually, and it was too hot to operate. And so he said, we have to cool the room. And the nurse went and opened the window.
That's crazy.
And he said, no, he says,
That's crazy.
And at that point, he said the lights clicked and he said, I have to provide top class private healthcare.
And he made it, he took it on himself.
He took it on, he did it. And he did it. And
he didn't
kudos to him.
Argue with the government.
No.
And say what the government needs to do. He said,
I'm sure there were some tough conversations.
We could do this.
We could do it. And he buckled down, and kudos to him, the family, and everybody who was on board for that journey, the nurses, the physicians, the medical staff, office. Since then, that spirit of how do we fix problems and fix issues has been the driving force for Doctors Hospital since.
That's a wonderful thing, man. So tell me when the gala is going to be. Let persons know how they could be able to participate. And all other persons actually be a part of that in the community. But tell me when the gala is. Tell me what we can do to be able to participate, what you got going on during that time.
Appreciate that. So the Doctors Hospital Maya Rasan Foundation is a nonprofit arm, a nonprofit foundation which focuses on providing assistance financially to young people who are pursuing careers in healthcare. Not just physicians. We support EMTs. We support rehab technicians. You name it. Once you are in a profession or want to pursue a profession in healthcare, the Maya Rasan Foundation is raising funds to support you. And over the 25 years that the Maya Rasan Foundation, the Doctors Hospital Maya Rasan Foundation has been in operation, we've assisted over 600 students, over $500,000 in scholarships. And so this year, 2025,
How many years you've been doing it now? Sorry?
25 years.
25 years.
25 years. And interestingly, this year, Doctors Hospital...
$500,000 in 25 years.
In 25 years, yes. Interestingly, Doctors Hospital celebrates 70 years of operation this year, and the Doctors Hospital Maya Rasan Foundation celebrates 25 years of being in existence. And so on February 22nd at 7 p.m. at Baha Mar, we are hosting.
This is an amazing thing that you did within 25 years.
Yeah, I mean it's a team effort, and it's at all levels. But ultimately, we say it's the vision that's driven by our leadership team. We have a wonderful group of executives in our C-suite that are all about providing access and affordability.
I feel like this is sort
healthcare.
of the beacon and shining light, and not because you hear I'm saying this. Like I said to you, I do all my stuff whenever my family needs to be able to get taken care of. Doctors Hospital is where we go, right? So I look at you, I look at your space when I walk into the hospital. This professionalism, right? This polished environment, right? Is sort of the environment that we envision. Like a lot of persons, I got to go to the States for this. I got to go here. I got to. But if you really take the time to be able to go into Doctors Hospital and recognize the professionalism and the consistency, the level of service that you can be able to get in here, man, this is superb. I want to commend you guys for that.
Thank you for your kind words.
I got to commend you for that.
Thank you. And in fact, what's so exciting is that we've expanded that professionalism, that quality of care beyond the hospital, the four walls of the hospital. We've opened up the about 13 outpatient medical clinics which provide primary care at all of the locations, some urgent care. And what we focused on is that we know healthcare is expensive. We hear it all the time, right? Doctors' Hospital is expensive, right?
Yeah.
You hear it. But what we know is that one, prevention is better than cure. And so we focus with these medical clinics on heavy on prevention. First you get your annual physical at a very affordable rate. You have wonderful physicians that are there that are accessible. And then it's okay. if you have high blood pressure, how are we going to manage? What is our plan, patient and physician, to manage this high blood pressure? How do we manage the issues that you may be experiencing so that when you do go to work, when you do go about your day, you can do it comfortably knowing that you have Doctors Hospital as your partner in healthcare?
Tell me about this loyalty program also. I like this because you started to talk about that and these steps that you're going to be able to take with the intimate knowledge and understanding that there is someone who cares here for you. So tell me about this loyalty advantage and loyalty program that we have in these areas.
So with the Loyalty Advantage membership program, which is long, and the shortened version is LAMP, is a unique membership program, one of a kind in this country. And I say it's one of a kind for a few reasons. But what we do is we bundle our services that we have the same quality care that you mentioned. Instead of buying this one thing here and this one thing here, just like how you would buy groceries or certain things wholesale, we bundle those services together as if you had a Costco membership, and it brings the price down, and it's all packaged into a low monthly fee, and those services are accessible at our locations. There's primary care, there's unlimited primary care, there's urgent care with LAMP Ultimate, where if you have a rash or you have a sprained wrist, if you have a burn, you come in.
Urgent care for a rash? This is a lot.
It depends. Healthcare is so diverse, right?
Yeah.
And so rashes have different levels, right? Sprains have different grades. And so you come into us as a LAMP Ultimate member with your plan. You receive discounts as deep as 30%. Your urgent care visits are covered. There's primary care. There's prescription medication. There's a flat fee of $25 for a list of about 50 to 100 different prescription medication. And so what we are able to do is, because we have such a broad capacity and knowledge in the area, we are able to bring the cost of delivery down.
What about pre-existing conditions?
There are no barriers to entry for pre-existing conditions. There are no age caps. You come, you sign up. There's a monthly fee. There's a 30-day wait just so we have time to process you and put you into the system. And this is another benefit, because once you are in the system, if something happens, we can address you and help you quicker, because we know Howard Grant. He had his annual physical here 2 years ago. This was the issues on.
So you get annual physicals.
Annual physicals are completely covered. If I have to come
and check up, if I have any
labs,
issues.
if you come to a doctor's hospital physician, labs are completely covered.
What are the tiers? What are the various tiers? You started to say ultimate package, so that means you get some other packages.
Right. So there's one which is LAMP Access, which is free to join, and you get a 10% discount on labs and imaging and pharmacy. There's LAMP Primary, which is primary care, so preventative things, screening, annual physicals, getting labs, and so forth. Those have a discount applied to them, and LAMP Ultimate they're free. They're completely covered.
You get access.
Primary for $40 for primary.
And then
Ultimate is $119 a month per person. And they also have family plans you can bundle together if you have a spouse and children. We also have corporate plans and group plans. So if you have a company, if you have a business that for whatever reason cannot provide healthcare benefits or benefits to your staff, for whatever reason, if you come to us, we will create a plan that fits your business profile.
Let's say hypothetically I work with the government.
Yes.
And the government is taking care of me in terms of insurance. But I use your services more specifically. Is there any conjunction or is there any additive? Like, I know I can get a reduced rate. Do you put 30% on top of that still? So
LAMP is geared towards those who are the uninsured.
Ethnic black question. I just want to be so
LAMP is really geared towards the uninsured, the people who cannot get insurance for whatever reason. We provide an alternative and access to healthcare where you can feel comfortable going about your life and about your days, knowing that you have a partner in Doctor's Hospital.
Can I put this on a pay cycle for
yes,
hypothetically with my credit card or something like that?
Yes, we have you as an individual can sign up for a monthly payment plan where every month it is charged. You could say I want to pay quarterly, I want to pay monthly.
So if I've been rejected because of pre-existing health conditions, let's say I have HIV, let's say I have diabetes.
We have HIV patients, correct.
Let's say I have cancer or whatever the case may be.
There are no barriers to entry into the Loyalty Advantage membership plan.
Because I couldn't get in nowhere else, but you could provide me this.
Yes, and in fact,
direct access.
Yes, and in fact, let's say you had a company and you had staff. we provide discounts based on the size of your company. And we know, and there are some companies who say, listen, we want to pay for the membership for all of our staff, right? Because it's that beneficial to the regular operations of the individuals. We want them to be healthy, so they can show up as their best selves. And then there are some companies who say, listen, we'll split the cost. Yeah, the staff pay 50, we pay 50. And so we have so much flexibility with this because we have that capacity, we have that knowledge, we have that expertise over 70 years of providing world-class healthcare to the Bahamas.
Now, we know that you have talked to, this is the last question I have before you be able to give your numbers and information. Last question I have. For those persons who have pre-existing conditions, couldn't find service anywhere, they're advanced in their state, whatever their state is, and they're advancing. They're not necessarily getting better, but they still want to be able to, everybody want to live. So they come to Doctor's Hospital, they sign up, they got everything, they decide to go with the ultimate package. Do you have any affiliation off island, any international affiliation in the event that we need a particular surgery or something like that you can't get done here, but it can be done elsewhere?
So I'll say this: there are very few things that we cannot do. Very few things. We have a wide range of expertise. Our physicians are sometimes asked to come and go to other hospitals to perform. Right. So we have the facility, we have the knowledge. But LAMP is only accessible and available at Doctors Hospital facilities. So, and that could be in Exuma. So you may be someone who lives in New Providence. You go over to Exuma for a trip for the weekend. You're on the ATV. You fall off the ATV. You break your hand.
You put the mouth on the people.
You go to Exuma Clinic and you get taken care of. And you say I'm a LAMP member. They check the system. They check the system.
It was just getting
so you got the rocket launch, right? So the rocket launch coming to Exuma. If you go there and something happened, you got to go to the clinic. The Exuma clinic is right there. And
we're in the system.
And you're in the system. And the beautiful part of being in the system is that you can now move through the system easily, smoothly.
Throughout the 13 outpatients locations throughout Nassau, throughout this Eagle Initiative, whether that is Eleuthera, Exuma,
Grand Bahama,
Abaco, Grand Bahama,
you
Long
name
Island,
it.
no matter where you are.
You name it. So if you are in Exuma,
access.
right? So if you are in Exuma,
so you cover the entire Bahamas
essentially, and we are the only medical membership plan that has that level of coverage in terms of scope and in terms of scope in the Bahamas, and in terms of care, including primary care, urgent care, and emergency care as well.
Put your numbers and other stuff out there. Let persons know that they can be able to get in contact with you. And if they want to contact you for the Maya Rassin Foundation Gala, let them know how they can be able to get in contact with you.
Okay, so first, if you are interested in the LAMP program, you can email us at LAMP, that's LAMP, .doctorshosp.com. You can also call us at 822-1009. There's WhatsApp on there as well. If you're interested in joining us at the Foundation Gala or contributing as a corporate member or as someone who wants to give back to healthcare, just email us at dhfoundation@doctorshosp.com. So for LAMP, it's lamp.doctorshosp.com, 822-1009. And for the foundation, it's dhfoundation@doctorshosp.com.
This has been an excellent conversation. You bring some old memories back with Dr. Cavallo down there in 8 Maroc. I want to commend you guys down there at Doctors Hospital for really leading the way for healthcare in the country. You guys are excellent at what you do.
Thank you so much,
are.
Howard.
I just want to be able to say that. Guys, we're going to take this quick break and get right back. This Carlyle Bethel being able to sit here with us, enjoy that conversation. Going to see you on the other side.
The Foundation with Howard Grant.